This is the fourth in a series of presentations on seasonal affective disorder, treating winter sad. Winter sad is a subtype of major depressive disorder. It recurs seasonally. Onset begins in late September or early October. Symptoms intensify through the deep winter months of January and February. The condition is self-correcting. Even without treatment, symptoms of winter sad improve, beginning in March and April, and they remit fully, with no symptoms evident through the late spring and summer months, until the cycle repeats. Winter sad can include some or all of the following symptoms: depression, sadness, a feeling of emptiness, low energy, trouble concentrating, excessive sleep or hypersomnia, difficulty getting up in the morning and getting through the day, increased appetite and weight gain, and often a carbohydrate craving, social withdrawal, often a decreased sex drive, and little interest in formerly pleasurable activities. Winter sad significantly impairs daily living. It can have a ripple effect on feelings of self-worth and general outlook, on family life, on work and productivity, social activity, even relationships. A multifaceted approach is usually best for treating winter sad. It may include counseling, often cognitive behavioral therapy or CBT, diet and exercise, outdoor activity, medication or herbal supplements, and light therapy. It's important to be proactive in treating winter sad. Layer your treatment plan from September through early April. In September, get a checkup. Schedule a session with your counselor. Consider medication and start light therapy, and watch your diet. In late October and early November, be sure to exercise, get outdoors, and increase your light therapy if necessary. As the winter months intensify, consider group support and maintain your program. If you can, plan a vacation to a sunny locale, and think spring. Just as you've layered your program step by step, beginning in April, you can start to strip away each one of those layers. If you're new at this, you might want to keep a daily log of mood, weight, medication, and light therapy in order to see what's best for you. Currently, light therapy is the #1 treatment choice for winter sad. What is light therapy? It's exposure to very bright, full-spectrum light. Light that's brighter than indoor light, but not as bright as sunlight. It's controlled by light devices or light boxes, and it's administered for a specified amount of time each day. How does light therapy work? We don't know for sure, but we do know that it acts on the body's own response to light. It helps synchronize our internal biological clock with external time, that is, daylight and darkness. It can reset our circadian rhythms and sleep cycles, and it may stimulate the brain's neurochemical production, providing an antidepressant effect. How is light therapy delivered? It's delivered through bright, full-spectrum light devices, or light boxes, and it's delivered in a way that can be integrated into your daily routine. Light boxes come in all shapes and sizes. There are stationary light boxes that you can use at home while reading or working on the computer, getting ready for work in the morning, or while eating breakfast. There are also portable light boxes to use when you're traveling, and bright light goggles for those who are a lot more active. And you can find bright light rooms in offices, even hotels, mostly in European countries such as Sweden and Finland. When considering light therapy, you need to know about illumination, distance, duration, and time of day. That is, how bright should your light therapy product be? How close or how far away should you position yourself from the light? How long should you use the light product each day? And what time of day is best? In terms of illumination, your light therapy product should be at least 10,000 lux of illumination. That is not as bright as direct sunlight, but certainly brighter than your living room floor lamp. And when using light therapy, you should always use it under normal room light illumination, not in a dark room. Position yourself at least 18 to 24 inches away from your light product or at a comfortable distance. Light should be projected downward toward the eyes at an angle to minimize glare. Be sure to keep your eyes open and don't stare into the light. Duration is usually 15 to 30 minutes unless otherwise directed. Stop if side effects occur. Lower the dosage the next day, then build slowly. Be sure to always time yourself and avoid excessive duration. More is not always better. Morning is the best time of day for using light therapy and treating winter sad. Generally, no later than 9 a.m. Timing does maximize effectiveness, and so does consistency. Be consistent. Maintain a daily schedule. Consistency is important in obtaining the benefits of the phase-shifting effects of light therapy. And consistent morning light is most effective in correcting the delayed sleep-wake cycle of winter sad. In a sense, getting us back on our desired schedule. Choosing a light therapy product is not an easy task. There are hundreds of products out there in an unregulated industry. So be sure that at the least, the product you choose is designed for seasonal affective disorder, that it provides at least 10,000 lux of illumination and filters out harmful ultraviolet light. Also that it fits your lifestyle and purposes, and if possible, that it includes warranty and return policy. There are a number of precautions to keep in mind when using light therapy. It may be best to consult with a mental health or medical professional before you get started. Also, follow manufacturer's specifications of the product that you choose. You might want to start with a short duration in the first few days until you get acclimated to the light therapy. Don't stare directly into the light. Avoid overdose or excessive duration, and remember that tanning beds are not a substitute for light therapy. Potential side effects may include feelings of agitation, like too much caffeine, nausea or dizziness, eye irritation or eye strain, insomnia or early waking, and hypomania with bipolar disorder. Avoid use of light therapy products if you have a pre-existing condition of the eyes or skin, or if you are taking photosensitizing medications or supplements. If you're not sure, consult your medical professional or pharmacist. When should you expect results? Generally in 7 to 10 days. If there is no change, then you might want to adjust the distance and position of the light product and the duration of time that you're using it. And be sure that you're using the light product at about the same time each day. If there is still no change, then consult a mental health or medical professional. Finally, where do you get a light therapy product? A prescription is not required, but some insurances do cover the cost of a light box. In that case, you will need a prescription from a medical professional. You can purchase light therapy products from pharmacy chains such as CVS and Walgreens, from medical supply stores, and online where you can research hundreds of products. Thanks for listening to this presentation. You can access other presentations on seasonal affective disorder from this website, including seasonal affective disorder, it's not just the winter blues, seasonal affective disorder and our biological clocks, and winter sad and the environment.